clinical governance, let's delve into this topic with Dr. Fernando Macário, our Chief Medical Officer at M42, to uncover how crucial clinical governance is in today's healthcare landscape and what kind of chaos it would ensue without it. So over to you, Dr. Macário. Thank you.
Thank you, Dr. Rizwana. It's for me both an honor and a pleasure to be here at Arab Health 2025, representing the new Corporate Medical Officer for the Global Care Platform. And Dr. Rizwana, we've been working since summer hard to put in place this new Corporate Medical Officer, and I could acknowledge that you are a fantastic doctor.
Thank you.
So let me start with two clinical cases. If you picture this, imagine that we have one patient coming into the emergency department with a chest pain, something that can happen in my age. And a very highly trained team starts the action. They do the diagnostic tests, swift interventions, seamless coordination to save the patient's life. This is a textbook example of healthcare in its best. Now imagine a patient with a similar condition that goes into another hospital and there is a delay ordering the tests, there is a miscommunication within the team, and then they are not sure about the best medical protocol, treatment protocol, and they argue that the outcome can be tragically different. What is the difference? The difference is of clinical governance or the lack of clinical governance. This highlights the relevance of clinical governance in our daily practice. So, this is just an illustration of how we can have such different outcomes with different way of approaching healthcare, with different organizations. And that's why we need to set up the right clinical governance within M42. We already have in place extremely good quality of care and clinical governance in all our assets and all our regions. But the idea now is to bring this to another level, corporate level, and to bring value to our patients. So let me move for the next slide. Our mission that we defined together in this corporate medical office team, we want to develop a comprehensive, sustainable, innovative medical governance that will position us as the global leader in healthcare, together with the expansion that we want to do for other regions. And we defined 5 key objectives with our team. 1, to promote clinical excellence and strengthening medical staff governance. Having a culture that is aligned with the international best practice and with the corporate culture. Because this balance between corporate and clinical governance is critical for an organization to strive. Then we want to elevate quality and patient safety standards. This is absolutely critical in healthcare. And we can only do this if we have a standardized framework approach to the way we deliver care. We want to lead digital transformation, innovation, AI in healthcare with cutting-edge digital health technologies. I think this M42 is by far the company that is best positioned to do that with everything that is already in place. We want to develop a state-of-the-art population health platform to identify high-risk populations, because our obligation is not only to the person that we are taking care of, it's also to the populations that we are supporting on this. And last but not least, we want to drive precision medicine working with a seamless integration between all our assets. We want to drive education, both for our staff, but also for our patients and their families. And we want to lead research initiatives on our company. What are the key principles and the foundations for this? An holistic, patient-centric care, going in the direction to fulfill the patient needs, the patient preferences, and in the end, the most important outcome, health-related quality of life of the people that we take off. I already spoke, but I will repeat it several times. In our mind, we have innovation, digital transformation as one of the key drivers that can support the development of this governance framework. Quality and safety assurance is always in our mind, using the right clinical protocols, the right education, continuously improving patient safety and outcomes. We want that all our patients are number one case, not the second one. So that's what we need. And then we need to have a transparent accountability on everything that we do. We will be accountable for the outcomes that we will have. Well, this is M42 is a global platform with a diverse portfolio of what we call now medical clusters. Of course, renal care, not only dialysis, but also the other stages of care on kidney diseases. Within M42, we have Diaverum, where I come from, and it's a renal care provider presented in 4 continents, more than 25 countries, 460 clinics, very successful, treating more than 42,000 patients. What is the secret behind this success? It's clinical governance. Again, always aiming for best standards, best quality, the innovation. Outpatient and chronic disease. Chronic diseases are a major burden today. I don't have to repeat that. Diabetes, cardiovascular disease, and others, metabolic diseases. So it's another extremely important healthcare cluster that we need to develop, and on that I think it's one of the areas where we can support more the populations and the healthcare institutions and different countries. Diagnostics, it's critical today. We are already incorporating genomics in our work. This is how we can drive precision medicine. Women and children health. And last but not least, long-term care. We know that the populations are aging more and more everywhere in the world, even here. So this will be a growing issue on the years to come. Now, just the last piece of this presentation to explain how we are designing the team for this. We are building the foundations of integration with an horizontal integration, standardization of clinical protocols, unifying safety guidelines, centralizing research efforts to have a cohesive approach across all the institutions. And then we need vertical integration, tailoring care models to the different assets and to the different geographies where we are. As you can imagine, without this high-level corporate integration and then vertical integration, we could not have the success that we had in so many geographies, giving the example of Diaverum. And as we need to expand our care to other areas, this will be the same principle. We want to redefine, we are redefining already the models of care, moving beyond traditional healthcare delivery. We want to establish innovative models supported, as I was saying, by digital, AI. We want to go into preventive medicine, personalized medicine, precision medicine, and we want to put this in everyday practice to all the people that comes to our institutions. Our goal is also not only to address the burden of chronic disease, but going before that. We need early detection, we need prevention, we need health promotion, well-being policies, and we need to bring this to our teams. And last but not least, we want to expand the impact across all healthcare areas. Genomics, leveraging genomics and precision medicine to change the way we treat conditions like, just to give you some examples, like cancer and other extremely important chronic illness that are affecting our populations. We want another aspect of clinical governance is to improve the access to healthcare, to improve the equity on healthcare. It's also a social responsibility that we have, and we can do that only if we have in place the good clinical governance, the good frameworks, the good organization. So I think with all of this, M42, that is a wonderful company, it will be the global leader in clinical excellence and as a pioneer of transforming healthcare, going to models of value that will help the populations, the company in itself, and also our stakeholders in different countries. This is our mission. And for that, at corporate level, we have a new team that started already working and that I would like to present you. Dr. Rizwana, she does not need to be presented.
Thank you.
As you know. Second one, she's not here, Carla Santos. She will be responsible for nephrology and international centers of excellence. She works with Diavero for 23 years. We have Lindsay Taylor, our keeper of safety and quality in the company. She's doing an amazing work. I just asked her, please keep doing your fantastic work on this. Raya Zayedin, I don't think she's here, but she brought me a new vision on how to measure pharmacy and therapeutics, and she will bring the pharmacy to the clinical team. Clinical pharmacy is critical for the success of the way we treat our patients. Carlos Lucas, for a long time, also for 23 years in Diavero, she will lead digitalization and innovation. Carlos, she's in front of you. Stand up, please. Okay, so people can see you. Adam Griffiths, where are you? You're there. Nursing. Nursing is the biggest and more important clinical team that we have. So Adam will enhance the importance of nursing in our team. Marian, thank you so much for joining our team. She will be responsible for population health, chronic diseases. She's bringing a lot of new things already. Thank you so much. Last but not least, Vivian. She's a researcher, she's a scientist, and she will be responsible for precision medicine and also for education and research. So in a nutshell, this is how we are developing clinical governance also on a corporate level for the new M42 Corporate Medical Office of the Patient Care Platform of M42. Rizwana, thank you.
Thank you so much, Dr. Fernando, for this wonderful presentation. You have beautifully laid out the vision of the new M42 clinical governance framework and how it will transform healthcare delivery in the next few months and years. However, what challenges do you anticipate in deploying this clinical governance model at a massive scale as M42 is, and how do you plan to address them?
Okay. Usually I don't think a lot about challenges. I think more about opportunities that we have. And when I started to work with this team, and when we started to behave as a team, I thought, well, this is going to be easy. But of course it is not. First of all, we are talking about a kind of a shift in some aspects that we need to change. And one of the challenges is to bring standardization. And to bring standardization to the different assets and to the different regions, respecting the extraordinary things that they are already doing. So when we talk about standardization, this does not mean that we will tell people how to do things. It will be the other way around. It will be from the bottom up. And one of the main challenges is to bring now more than just the corporate medical office in together, all the people in the assets. That will be our first challenge, to work together with everybody at asset level to help us build the right clinical governance in every institution where we are, in every region. So for me, the biggest challenge now is to have everybody working together in the different assets, in the different regions, building this. Of course, we have a plan for that. We intend the group will be more than just corporate medical office. We will work with each asset. We will go there and we want them to build the way they want to establish the clinical governance at each asset. This is the first challenges. For that, we need to have the right support. And we are building also a medical advisory board with people from all the institutions, plus some external people to support us on building this. Because we were not born with all that we need to learn also. So the biggest challenge for me is to bring everybody to this project, enhancing the clinical governance everywhere. The other challenge is the way we will interact with the stakeholders. We don't need to build this only inside. We need to build this also together with all the other stakeholders. And this, we are already starting working on this. And we are here to collaborate, to support also the health departments, not only in here, but in other locations, because this is the first challenge, is to expand internationally the wonderful things that we are doing here. I know very well many different international places. I know many countries coming from Diavero. I've been traveling all over the world with different health systems. Some of them are very challenging. So one of the other things that we need to do, we need to take this healthcare culture, quality, innovation that we have here to other locations. And then each country is different. Resources are very different. The healthcare professionals are not the same everywhere. But here we have a big example of working with people coming from all over the world and developing the high quality of care that we have here in this region. So another challenge is to bring this not only for dialysis that we already have, but for other areas of care.
Thank you very much. So you rightly mentioned that this is a huge task and you'll require everybody's support and participation to make this clinical governance model successful. What role do you think leadership plays at an institution level and at a corporate level in fostering these principles of clinical excellence and governance model? Thank you.
I think the first thing that we need to do, and we are doing, is to listen to the people, to go everywhere and to listen, to build together the way we want to go. This is the first step that we need to do. And it will take us some time, of course, but then we need also to support everybody with the right tools. Electronic health record systems, we need some standardization on that. We need to bring the digital innovation to everywhere. I think it's also another critical aspect. We need to build the right healthcare platforms for chronic diseases. That is one of the main burdens that we have. So I think this, and then we need, this is a big project, as you said. This is something big, but everything becomes simpler if you start to put it piece by piece. And if you address each piece at each time, and then you bring this together in a cohesive manner, then everything becomes easier. So one step at a time, a big organizational effort to start this process of standardization, keeping always in mind what is our mission. We can never forget that. And of course, we are a big company, so we need to bring also this harmonization between clinical governance and the corporate governance, because the other aspect that is key is the medical group. And when I say medical, I say physicians, nursing, pharmacists, other health. They cannot work alone. They need to work with financial people, the operational people, the human capital. So this interaction between the different functions within the company will also be key to success. I think we are in the right direction for that.
Thank you. That's very apt. So as you mentioned, Dr. Fernando, this is a very aspirational project. And there are multiple components, like you mentioned, quality and patient safety, clinical staff affairs, education, research, artificial intelligence, precision medicine, population health, digitalization, and so on and so forth. So to implement this across M42's diverse medical clusters, how would you approach a phased rollout of this clinical governance model to ensure that it can reach all the multiple different institutions which are very diverse across M42?
Well, let me start by saying one thing. We have a good clinical governance in each of the institutions, each of the assets, and in the regions. The fundamentals are there. Now we need to benchmark. We need to find the best of each one, put everybody working together, communicating, talking, and bring the best of each to the other ones. We cannot work in silos. Even if we work very well, we need to think that we will be much stronger if we all work together for the foundation principles that we are defining. And one of the examples of this is education and research. Research, if done in an isolated way in each one of the institutions, will never be as strong as if we have common defined programs for education. That does not mean that we are killing what is being done, not at all. We just want to enhance, and also, if it is a good example, to bring it to other assets. But to give you another example, if we want to apply to grants for research, we are much stronger if we apply as M42 research group all together than if we do it isolated. So I think we will be stronger with this. So I think that's the key aspect. Let's put everybody communicating the right way, and the role of the corporate governance is to oversee this and to try to bring some framework to this.
Thank you. We have 1 minute left. We have time for one question. If anybody from the audience wants to ask something. No questions from the audience. I think, Dr. Fernando?
You made so many questions. Maybe we should have started with asking them for this. But we will be around, and I will be very happy to discuss this with you.
Thank you so much for this wonderful presentation and your vision and idea about clinical governance framework, which is very much essential in these times of big organizations such as M42 with its diverse medical platforms. Again, thank you so much for your time, and thank you everyone in the audience for staying with us and supporting us. Thank you.